good afternoon, Michigan State University community. Welcome to the quarantine question and answer event that we're having. We have a few guests on our panel today, and they are going to answer some questions about the quarantine emergency order that came from the Health County. We also have our university physician and our interim dean of students to help with some question and answers that came through. If you have questions currently or have questions that you want to ask, there is a question and answer box below on your Zoom. So please type in there and somebody will be responding or having your questions answered and asked. So at this point, I'm going to turn the program over to our Vice President of Student Affairs and Services, Dr. Denise Maybank.
Good afternoon, everyone. I am honored to host this event today, this live stream event, and I trust that this will be beneficial for all of you who have joined us. I trust that you are here to get information that will be useful to you in some way, and that the questions that you've submitted will help in making sure that everyone has the information that they need. So we've taken your questions. You may not hear them exactly as you submitted them, but the gist of what you have asked will be incorporated into our time today. We have a tight hour because some of our panelists will need to jump off at 4:30 exactly. And so we will be moving forward, but please get the additional questions into the chat. And to the extent that I can, I will get them asked to the panelists. So we want to get started with introductions. And I've asked each panelist to introduce themselves with their titles and any brief comments they would like to make at this point as we open up. And then we'll get to the questions that have been posed. And some of it will be also my wanting to make sure we frame some things for you as a community, for IFC chapters, for PC chapters, and for anyone who has chosen to be a part of this space with us this afternoon. So I will start with Dr. Linda Vale from the Ingham County Health Department. So.
Hi, I'm Linda Vale. I am the Ingham County Health Officer. I have been health officer here in Ingham County for 6.5 years now, running a very diverse department with almost 400 employees and some primary care clinics that are part of a federally qualified health center network. Prior to that, I was the health officer in Kalamazoo County for over 7 years. So I have about 20 years experience in public health, and prior to that, about 20 years experience in infectious diseases and infectious disease research. And that's who I am.
Thank you, Dr. Vale. Dr. Shoyinka?
Hi, everyone. My name is Nikesh Shoyinka. I am the medical director at Ingham County Health Department. I haven't been at Ingham County as long as Linda has been. I've been the medical director there for a year and some. I'm also board certified in infectious diseases and internal medicine, and residentially trained in preventive medicine. So I do a variety of things at the health department, but one of our major jobs right now is COVID response, and we're happy to answer your questions as time goes on. Thanks for having us.
Thank you. Dr. Weismantel.
Hello, I'm Dave Weismantel, University Physician and Executive Director of Student Health and Wellness. And I guess for purposes of this, I am one of the point people at the university for our COVID response and for our gradual return to campus and hopefully normal activities in the future. So I am just happy to be here in support and to help answer any questions. Thank you.
Thank you, Dr. Weismantel. Dr. Strong.
Thank you for being here today. My name is Philip Strong. I'm the Interim Dean of Students and Assistant Provost for Academic Standards and Student Conduct. Our office administers the student conduct process for the university. We also administer the processes around academic integrity if faculty file academic dishonesty reports. And we also manage the medical leave process. Thanks for being here today.
Thank you, Dr. Strong. So I'm going to begin with a baseline kind of question, because I'm concerned that people have misperceptions about COVID-19. So Dr. Weissmantel, I'm going to ask you just to talk about the nature of what COVID-19 is, how it is spread, and why we are concerned about it at this point. So Dr. Weissmantel, would you kind of give us that general contextual information?
All right. Well, COVID-19 is a virus that is primarily spread through respiratory droplets and through airborne transmission that we're finding more and more now. You know, its clinical presentation is anything from for asymptomatic, no symptoms at all, to a very significant life-threatening illness, what we would call multi-system failure type illness. Many people experience mild to moderate symptoms of nasal congestion, cough, fever, body aches, loss of taste and smell, vomiting, diarrhea. And in the younger populations tend not to experience as severe symptoms. However, some do, and some actually have very significant illnesses and even death, even in the younger age groups, age 20 and below. It is infrequent, but yet important. And the spread is primarily through social contact with other people who have the illness. And I know that Linda and Dr. Schrenka will probably say the same things. Our main weapons to fight this right now are physical distancing and face coverings. And that can have a very significant effect on decreasing the transmission to others. And the most important person to be wearing that face covering is the person who may not know that they're infected who are infected. It does help prevent spread to you if you are wearing it, but the most effective part of it is for somebody who has the virus not to spread it to others. And I guess I'll just stop there and be very happy to answer any questions further on the virus itself if needed. So thanks.
Thank you, Dr. Weissmantel. So the unfortunate benefit for all of you is that I will be making commentary in between some of these answers as well. So one of the things that I am concerned about when I am out and about, and as it relates to face coverings, is people figure I have a mask. The mask is around my neck. I might even have the mask over my mouth, but my nose is exposed. So, Dr. Vale, when that is the case, what does that mean for me as a person who is concerned about the droplets that Dr. Weissmantel just talked about? Dr. Vale, you may need to unmute. There you go.
Yeah, what that means is essentially you might as well not be wearing a mask. So a mask that does not cover the nose and the mouth is not a mask. It is just something that you're wearing around your face. I've seen them on the chins and all that as well. And to add some commentary to Dr. Weissmantel's point about the importance of wearing masks, it does provide limited protection to the person on the other side. The biggest thing, as he said, is that we don't spread it to others. With the number of people who may be asymptomatic or don't know that they're about to come down with the illness, that's why they're important, because you don't know. And if you don't know, the best thing to do is to be wearing it to protect others. Your masks protects me, my mask protects you. The two together really dramatically affect transmission and lower risk significantly.
Thank you, Dr. Vale. You know, I've heard someone say, you should act as though everyone has COVID. Don't try to figure out whether or not you're in a group or around someone who, just because they are asymptomatic, they would not have the virus. Just assume everyone does and act accordingly. So if you see me out in the supermarket trying to get the provisions for my weekend or for the week or whatever the case is, I want that 6 feet of distance. I want to be able to know that I have enough distance. I have limited time in proximity to anyone so that if anything were to happen, I know I've done my absolute best. I've taken the personal responsibility to mitigate the spread of COVID-19. Dr. Shoyinka, I want to make sure you get a chance to weigh in on these points as well. So I'm going to give you an opportunity here.
Yeah, in addition to, everything that Linda and Dr. Wiseman have said, all the measures that we take for prevention are important. One doesn't work 100% versus the other. So wearing a mask is a critical piece, and wearing it properly, just as we said. If you wear it and you cover just your mouth, then all the potential aerosol comes out through your nose, even though when you're talking, some of that might be some form of protection. And then you want to add the other pieces to it, like you said, the social distancing and all those other pieces, because aerosols don't, even though we say a 6 foot distance, aerosols can go way faster depending on what you're doing, whether you're talking, yelling, singing, anything could mean 6 feet versus 20 feet. Coughing, sneezing are all factors that make the difference. And so that's where we have to do like that Swiss cheese kind of thing and do everything together. The mask, the social distancing, the hand hygiene.
Thank you very much. I think that these are critical points for us setting the context for the decisions that have impacted the fraternity and sorority life community most recently. You need to understand what is at issue and why these decisions are being made. So I'm going to go direct now as it relates to the mandatory quarantine for the houses. And there was a list of 30 that began this on Monday, that as we knew about it. And then I think one was removed, possibly two, and someone can correct me on that. And then today, yesterday or today, and 11 more were identified. So Dr. Vale, would you like to address that aspect in brief, and then we can come back for specific questions associated with the overall quarantine?
So congregate settings in general are a different situation than individual units. Please know that many, many people in individual units all across this county have been quarantined since the beginning and are currently quarantined on campus, or excuse me, off campus and off campus housing many places. Those are handled one-on-one with our staff. So there are many, many, many people under quarantine other than this. So when we deal with congregate settings, it is more of a group situation. There are a lot of sharing of different, and the close contact and those sorts of things regarding that living situation. So looking at congregate settings, as we would call them, larger groups of people sharing the same place with shared dining spaces and other types of shared things, that becomes a concern with the spread of COVID. So the quarantines themselves are based on known via data that we have, cases or exposures, as it says in the order, cases or exposures at these houses that have been licensed by the city of East Lansing for 10 or more. So what that means is that we may have known that someone who was sick or who became sick within a short period of time was at a party or a gathering at a house, and that caused the exposure, or there was somebody who was sick. And those two things are possible, and those two things are in the order. So any quarantine that's out there right now in the signs of the door is not a point of there are cases in here. There could be known exposure in there as well. So quarantine itself is basically to stop the transmission of the disease with those who have been in close contact. it requires 14 days because that is the length of time that we know a incubation period for this virus can extend to. One can test, say 7 days after a known exposure. That doesn't get you out of a quarantine situation because you could be that person that has a 14-day incubation period. So a negative test at any point in time during quarantine does not mean that the quarantine is over. There is still a 14-day quarantine. So lots of data, lots of information was looked at in order to identify places, congregate settings, licensed by the City of East Lansing, with addresses provided to us by the City of East Lansing in order to find cases or known exposures at those locations and quarantine.
Thank you. Dr. Weissmantel, do you want to weigh in at all on any aspect of this, particularly in terms of that 14-day piece? I think Dr. Vale really did touch on it and talk about why 14 days. But I'm curious to know if you want to weigh in at all and address any aspect of this part of our exploration today.
The only thing I'll add to that is it is just that it's a common misperception as far as that 14 days and for those that actually are diagnosed with the virus, that it's 10 days from the start of their symptoms. But for somebody that's you would think of as just a contact, that it's then 14 days for that person. And all the people that I'm talking to, it just seems a little unfair that it's 14 days and you're not even sick, but there is the science behind it, and it makes really good scientific sense to protect others that we have that 14 days for those that are close contacts. And I would just say that is the most commonly misunderstood part of this. And I guess you're giving me the opportunity to say that that 14-day quarantine period, you can't test out of it. Because if you get a negative test today, it still doesn't mean that in tomorrow or in a few days, you still won't develop the virus and test positive at that time. And that is why we have to go out the full 14 days for a quarantine, to allow anybody who potentially could develop it to develop it in a safe manner. So thank you for giving me that opportunity, Dr. Maybank.
No problem. I knew you wanted to get that message in, and I was going to try to figure out how I was going to keep pumping till I got the "you cannot test out of quarantine" communication clear. So please know that. It's, you know, some folks are figuring, well, they want me to do the Spartan spit test, or somebody's told me if I go to the stadium, I can get this test. Or if I go to Olin, I can get that test. You cannot test out of the period that has been established. And so the date has been set. Dr. Vale or Dr. Schoen, could one of you want to remind us of the original list from Monday, what that date is, what the 14-day out is?
So from
September 28th.
Okay. And what you need to know is that there may be extensions of that date for some. Would you like to address that, Dr. Schrader?
Yeah, so the reason why we chose the date September 28th is just as we've explained extensively, counting back for 14 days from the last identified case in these houses. Now, as time goes on, we continue to identify positive cases, and a quarantine is only as good as the last exposure. So if you have someone who has been in quarantine and who has not developed symptoms or infection, and they get exposed to someone who is positive, then the last date of exposure is when you start counting for that incubation period. If there's continuous exposure while that person is quarantining, then you still just have to wait. For example, if you're living with someone who does have, who's positive, and you are unable to, we see this a lot in household situations where you're unable to safely quarantine, you know, husband and wife with little kids, that kind of thing. What happens in those cases, let's say one person in that household is positive, and we have at the health department determined that quarantining, a safe quarantine is not possible because they live in closer quarters, then we would say that the person who is positive has to isolate for 10 days, and the quarantine for the people who live in that household starts after the end of that isolation period, because otherwise there is continuous exposure where we expect that that person is continuously shedding virus either by any of the methods that we talked about, talking, yelling, singing, you know, aerosol, you know, things on surfaces too. And so that's where that number comes from. So as we identify more cases within the house, the end of the quarantine becomes extended.
So I want to address a question that came in the chat, and I may not state this exactly again as you presented it, but the idea is that if it can be extended in this way, if the quarantine can be extended in this way, should those fraternities or sororities close their houses? And what might that mean? Because they are concerned that members are then told you're supposed to stay in place, you're supposed to quarantine, you're supposed to limit your interaction with others, but then somebody else is exposed and the date is extended, and then someone else might get exposed and a new date gets set. So should it be that they come out of their congregant living experience and do something different? And if so, what might that be? So I don't know who wants to start.
Did you address that to somebody in particular?
I did not address it to someone in particular, but since you have the view, go ahead.
Let me speak to that a little bit, because we did in our FAQ say that if you want to go to your home residence to quarantine, then that's okay. You know, what we need you to do is go directly there and directly back as much as possible. Because there still is a quarantine, just like hundreds of people are quarantined in apartments. It is not just fraternity houses, it's other large houses. What we don't want to see is people deciding that we will just come out of this fraternity house or sorority house or other large rental house. Again, it's not just fraternities and sororities, and move in with a fellow student or somebody in an apartment nearby and then just keep going around. Your choices are stay where you are or go home and quarantine at home. When you get home and quarantine, it is important that you still adhere to the quarantine period that you have. The risk that we all pose if that doesn't happen is that you go out and about in your community, and one, you have the potential of now exposing that community. The other thing is that you could get exposed while you're there unknowingly, come back and start living in the home again, become ill within a few days, and then we are starting this process all over again. So the importance of adhering to the quarantine, no matter where you are, is critical.
Thank you. Dr. Strong, I'm going to bring you into this conversation with a question that also came in the chat today. And so basically the question was framed as a legality. Is it legal for a student to be suspended from the university for being non-compliant with the health department? And so rather than have it be legalistic, let's talk about what it is that we are employing as a way to support the health and safety of the overall community.
So, and that is, and I appreciate the question, but it's kind of a loaded question, and it's kind of putting a juxtaposition of a couple of different items there. So let's first, let me talk about the MSU student conduct system, because I think it's important that you understand overall the basic processes that the university has in place. Students are responsible to the code of conduct, which we call the general student regulations, and any other policies and provisions that are placed, right, by the institution, right? Everyone needs to follow these rules and regulations as part of the community. The process for addressing potential or identified violations of such policies is the student conduct process, and the student rights and responsibilities document outlines that. At Michigan State University, we are what's called a complainant-driven system, meaning that a member of the MSU community files a complaint with our office identifying that they believe a student has violated one of the policies and wishes to move forward with such complaint. At that time, that complaint comes into our office, and then we initiate the student conduct process, right? And there's plenty of steps, and we can talk through that probably in a different setting, or you can go to our website and find most of those steps out there. I'll certainly talk about the important ones. But we're also talking about the end, right? What are the outcomes at the end of the process? When the entire conduct case has been resolved, if it is found to have a violation, there are a set of sanctions that can be implemented with students. And if you go to the Spartan Life Student Handbook and you look in the sanctions, I believe it's under Section H, Article 5, Section H, there's a whole range of potential sanctions. And that can go anywhere from a warning, a letter identifying that this behavior has to stop, these are the expectations moving forward. But on the far end of that, and this is for anything in the conduct process, is dismissal. A student through the MSU conduct process could be dismissed, right? So that's important to know as part of the regular conduct process. Yes, a student could be dismissed if they violate if they are found responsible for violation of a particular university policy or regulation. Of course, there are all sorts of factors that go into such a decision, and there's all types of different mitigating factors and so on, aggravating factors. We use a lot of different determinations, either through a board or administrative hearing. So I think the broad answer is, well, yes, of course, all potential outcomes are on the table through the entirety of the conduct process.
Thank you very much. I'm gonna go back to the health piece for a moment, but we'll be back, Dr. Strong, because I got some more questions for you as well. A number of the questions have to do with the data associated with what we have heard about COVID-19. So we hear that people test positive. We hear that people may be hospitalized. We hear that people have died, along with the various things that have happened as a result of having a positive outcome associated with COVID-19. I don't know which of the physicians might want to start talking about the public health pieces of this and the epidemiology that is associated with this particular virus, but can you talk a bit about what we know about the data currently? And particularly the questions have to do with data associated with the college age population. So the kind of 18 to 23, 18 to 26-year-old age group. So if anyone is prepared to respond to any of that, we would appreciate knowing.
I could start, and then, whoever else wants to chip in, include everything. So where do we start? So first of all, we know that different age groups are at varying levels of risk to COVID-19. And from what we've seen, the younger age group are less likely overall, comparatively, to be hospitalized or have severe illness. When we talk about people who are at risk, we talk about people who are older, people who have underlying conditions regardless of age. And so when we talk about that 18 to 23 age group, in most of the cases, a lot of the cases that we see do not end up having severe illness. A lot of the cases that we see also are asymptomatic. However, it is unclear what the long-term effect of infections are. Right now, there's a lot of data coming out with regards to athletes and what that means in terms of the occurrence of myocarditis, which is inflammation of the heart. And so some studies have shown that, in a cohort of college athletes, there have been up to 30 to 50% of individuals who had either current new myocarditis or possibly previous ones, which duration is not well known. And so there's a lot, even though there's a lot that is not immediate in terms of what we see in this age group, there is a lot of concern about what the long-term effects are. And we just haven't had COVID around for long enough to know what that means. The other important piece is that even though this age group is younger and has a milder form comparatively, we have had people who are severely ill. We have had people who have had multi-system involvement, depending on what those other comorbidities are. Obesity, diabetes, underlying lung disease, underlying malignancy, underlying other immunocompromised conditions, which regardless of age would put other people at risk. And so when we do have a lot of asymptomatic or mild cases around, the chances of having transmission to somebody who really shouldn't get it, that we know is going to have a problem when they get it, becomes higher as our numbers increase. When we have a higher number of people, then it just spreads, faster. So even though amongst ourselves here, we have a certain group, but as we interact with the community over time, it might not be immediate, but over a month. Remember, we said that incubation period is 14 days. So there has been contact with person A, and then over a 14-day period, somewhere in there was exposure to someone, and then that 14-day period clock starts for someone else. That person gets infected, and we move it along. And as that happens, the age group that is affected is not just our 18 to 23 that we say have mild disease, but then we now spread it out to those people who are, like I said, immunocompromised, or even the older age group that we know can get really sick and could have, where there's a high mortality, not even just morbidity.
Thank you, Dr. Shoyinka. Dr. Weissmantel, can you share with us the numbers that are associated with students currently?
Probably the best thing for me to do, I can look at our numbers right now, but I think probably Linda has even the numbers that I would find to be the most accurate overall for our MSU student population over the next couple of weeks. I hate to drop it on Linda like that. I can give what I know from our dashboard right in front of me, but I know that I am not aware of all of the cases that are happening as she is in the county. So
Okay.
hate to do that to you, Linda, but any chance?
Yeah, as of yesterday, probably in the range of 800 to 900 and growing daily. So out of and I haven't looked at today's numbers in terms of the number of cases, but what we're looking at is, probably, again, I'd have to look at today's numbers, probably going on close to 1,000 before very long now. And that is based on, our ability to look at addresses. In some cases, we are still working on getting data fields set in to make sure that we know people are students. We have a lot of people living in other places that haven't necessarily been identified as students. So what I will tell you is that that is probably an underreported number.
Can you talk about the number of hospitalizations among the student population and somebody gave a date of August 24th, since we came back, pretty much.
So we are not their medical providers, okay? So that is not always, when somebody has to go to a doctor or, that sort of thing related to it, that is between them and their medical provider. Oftentimes we do get that information. What I've seen so far is a number of trips to the ER related to severe symptoms. I did see at least one hospitalization related to an MSU student with COVID. But again, we typically do know when there's hospitalizations eventually because we have a track of our hospitalizations. But when somebody has to seek care for severe symptoms or go to the emergency room, that is not always information that we have. So I do know of some. I would suspect that that is, again, a number that is lower than what is actually happening.
Thank you. Dr. Strong, I'm coming back your way. So you talked about it being our student conduct process being a complaint-driven system. Can you talk about how it is connected to the campus compact that met everyone as we re-entered the space and time of being a part of the campus? Can you talk about how that is tied to how the compact and student conduct are related? And then there is a question that is very direct. It says, what are the best ways to stay out of the student conduct system?
I love that question, and I appreciate that question. So, certainly the compact identifies the behaviors and expectations of what we need you and us, right? So let's not pretend all of us here have to follow the campus compact as well, right? Expectations around COVID in which we all have to comply. And if faculty and staff aren't complying, they have to go through a process similar to our conduct process, but it's through the Human Resources Office, and it's around their employment, okay? So please don't think that you are the only ones out there that are going through this. Yep, you're testing really high. I won't get into the public health aspect of that. That's for my colleagues, but it's for all of us, right? So in our situation, if a complaint is filed, and I want to list a couple of, I'm just going to read off a different sheet here. There's 3 primary university regulations that are coming up when these complaints are coming into our office. And this first one is very important. I want you to really understand this. This is General Student Regulation 2.01. No student shall cause or threaten physical harm to another, or, and this is the important part, endanger the physical safety of another. And that is the big area where we're getting most of these complaints, because by very specific behaviors, which are in essence violations of the campus compact, you're being alleged, some of you are being alleged, that you are endangering the physical safety, the health of another person. That's why this is so serious in the conduct process. The other 2 key codes are, no student shall obstruct, disrupt, or interfere with the function, services, directives of the university, its offices, or its employees. Well, the university physician gave some directives. The university president gave some directives. Let's not interfere with those. And again, it's not just for you, it's for me too. I have to follow in line with that as well. And then the third one is, that was General Student Regulation 5.2. And then the General Student Regulation 5.9, no student shall violate other university policies or regulation, including university housing policies. So again, it's if somebody at the institution is identifying a clear pathway that you need to follow, if you violate that, a complaint may be filed against you for that violation, and that would go through the student conduct process. So that's kind of the big piece of where this is connected. And remember, I hope you're hearing this from everybody here. It is about the health and wellness and safety of you, of me, of everybody here. That's what we need to get across. I'll stop there. I'll get off my soapbox.
Thank you. So now I want everybody on the call or on the webinar to know that a lot of the individuals who are members of sororities and fraternities are feeling pretty ostracized right now. They're feeling targeted, and they feel that they're being watched in ways that really is uncomfortable. So I want to offer some opportunity to answer some aspects associated with how this is the focus, or why this might be the focus, that the sororities and the fraternities become the focus. And so one of the questions is, why are only some fraternities and sororities quarantined? Is this based on housing capacity? Or is this based on number of positive cases? Or how is this decision being made? So I'm gonna ask either Dr. Vale or Dr. Shoyinka to answer that question for us.
Well, Dr. Shoyinka is muted and missing right now. So
Okay.
basically, it only takes a case or a known exposure to put the rest at risk when there's close contact. So that's the standard for that. Why, some yes and some no is because that's where we have found contacts. And again, I will remind you, or a known exposure. For those of you who keep asking, we don't have a case, we don't have a case, or whatever. One, there may have been a known exposure. Two, you're not always privy to everybody's medical information sometimes, nor can I disclose that. So, and I want to answer another question that I saw here in the Q&A, and that has to do with publishing the list. I am working with the government. I could have issued 40 orders. They still would have all been public information. It is public information, which is why it's a list. So it's one order instead of 40, there's a list. Whether I had done it that way or a different way, that is public information.
Thank you. Dr. Weissmantel, I'm going to come to you to talk a bit about some of the things that are being offered on campus in terms of testing. I'd appreciate if you would talk about the Spartan Spit program and also talk about the other ways in which people are being tested and what is different and what this might mean.
All right. I'm going to start with the general testing on campus that's available. There is the normal COVID testing available at the stadium testing site run by MSU Healthcare, with the testing actually being completed at Sparrow or at our veterinary diagnostic lab now. The results from that generally take about 24 to 48 hours to turn around. Today it was 24 hours again. And that is for people that are symptomatic or are close contacts and would like to be tested. There is also another test available at the Olin Student Health Center. It is something we call an antigen test, and it is done in a slightly different way, but it is only accurate for people who are symptomatic. So we only use that in students who come in with symptoms of COVID, and not for those that are feeling well and are only close contacts. So those are the two sites on campus for those who want to be tested to find out if they have COVID-19 at that time. And I'll just mention in the community then, Sparrow and several of the urgent cares also have testing sites throughout the community. I think our sites generally get people in and out in the same time or less as many of those other sites. But and then the Spartan Spit program is something that is ramping up, and that is something that is intended for those that do not have symptoms at this time, that you would not even know that you had been exposed to somebody with COVID-19. And it is just something that on a routine basis that is being determined by our epidemiology team at MSU. If you enroll in the program, you are notified that in 2 or 3 days, it's your time to pick up a kit and leave a saliva sample for that to be tested. So that program is available to all of our MSU community members, and that would be students for sure. And the one thing about that right now is that you submit your sample, and within a day, a result comes back, and it will either notify you that you are not recommended to undergo further testing, or that you are recommended to undergo further testing that initial test says that indicates that you are at very high risk, that it shows that you are probably truly infected with COVID-19, but we need a single laboratory test to confirm that. So it is contingent upon that person to go seek out another test, and that would be at the stadium testing site for that. And that program will be much more effective when our general case numbers are lower, and it will help pick out the people who would not have any idea that they had the virus and were a risk to others, and decrease the chance for close contacts before they happen. So I hope I covered that territory. That's our current testing on campus, and I'm sure that over the next 2 months, that's going to change even further with more like what we call quicker and point of care testing, but we'll see what that brings.
Dr. Maybank, can I add on to that real quick?
Yes, please.
Because I want to dispel a couple rumors and give a shout out as well. It is first off the shout out. It's my understanding that actually one of the houses is going to take a leadership role in participating in spit testing, and I would like to make sure that you understand this, that is a wonderful, wonderful leadership approach, and we greatly appreciate that coming from the Greek community. The second is, and this is a rumor going around, it is not a violation for you to get ill. It is not a violation of, it's horrible that you would get COVID. It's not a violation of student conduct. It's not a violation if you test every other day. These are not violations. We want you well, we want you safe. Our office is dealing with students who are acting in behaviors that are putting others at risk. Contracting the virus is a horrible, horrible thing to happen, and I hope it stops immediately. Nobody else gets that. And those of you that have it, we want you well as soon as possible. These are not violations. So thank you, Dr. Maybank, for letting me jump in there.
Oh no, you were reading my mind, because my next question was going to be, based on a statement in the list of questions, students do not want to get tested because they think it will get them in trouble. So you anticipated and did respond to a piece of that. I don't know if anyone else would like to, but I think it's important to dispel that belief.
So I can just jump in really quick. It's the idea, testing is a critical strategy for the COVID response. It's just so important. It's probably one of the #1 pieces, because that's the only way that we can identify people who are positive and then adequately isolate them, remove them from a situation where there is continuation of spread, and then identify the people who have been exposed to that positive person and then quarantine. So the purpose has nothing to do with putting anyone in trouble. It is purely part of the public health COVID response in this case. And so when we at the health department reach out to individuals to find out about when we get a report of a positive case, or we get a report of someone who has been exposed, the goal is purely to make sure that we can do all of those pieces, the isolation.
Okay, for me, Dr. Shoyinka just froze. So maybe her internet will kick back in and we'll be able to hear the balance of that. And if I am wrong in that, someone can give me a heads up. But I'm going to move on to a similar concern. And it has to do with the quarantine itself having a chilling effect for people in terms of reporting and getting tested. And basically it's that the quarantine is discouraging people from being honest when they're reporting and being honest about the need to themselves about the need to be tested. Would any of you like to respond to that concern?
Can you phrase that question again? So it's discouraging.
Yes, the quarantine aspect of what's happening, is discouraging people from being honest about testing positive or even getting tested.
I can understand in turn, however, it will only cause more harm than good. People can be identified as presumably or positive by basically exhibiting all the signs as a case definition. The state does that. That's why we have probables on our list. So a confirmatory test is not the only way you can identify a case that fully meets the case definition. And this is the case for all public health matters and all public health diseases, is that sometimes we have a confirmatory test, sometimes we have a probable case, sometimes we have a suspect case. But the bottom line is not getting tested basically continues to have people who have COVID, maybe unknowingly or maybe slightly, and then we're infecting others, and eventually it's just going to continue to grow and impact the entire community in larger and larger and larger numbers. So while you might hide a case by not being tested, eventually the person that you infect gets tested, and then more and more and more, those numbers will be there, whether that individual gets tested or not. The way we protect people from getting infected is by being able to test and isolate and quarantine. And I hope that we care that there are other people out there who will get sick if we don't follow isolation and quarantine rules. And the way that we know to isolate is by testing. You live in a community that has many other people that live in it. You have many fellow students who may have had cancer or other things, and may have any number of conditions that might make them more likely to become more ill than maybe you. And I don't think any of us want to see severely ill students, students in the hospital, students dying. And I don't think we also want to see the neighboring community start to get seriously ill, be hospitalized, and die as a result of avoiding getting tested so that you can avoid isolation and quarantine.
Thank you, Dr. Vale. Dr. Weismantel, if testing is a critical strategy in mitigating COVID-19, mitigating the spread of COVID-19, why haven't we made it mandatory?
Why haven't we made it mandatory? Well, our initial thoughts were that we were going to be able to resume our normal activities with a lower level of COVID-19 in the community than we have experienced, that we would be able to test, isolate, and quarantine, and be able to have relatively normal operations. I think it's becoming more apparent through time that a mandatory test strategy may be necessary for some place like MSU to go forward in the future for more in-person and what we would consider normal activities on campus. And some of the things that have been brought up is like even the Spartan Spit program, could we make that mandatory? And that is the one program that we can't make mandatory at this time. And another kind of fact about where we were and where we're going, where we were having mandatory testing, just our availability to timely testing in this community was not, was reasonable for testing those that were symptomatic and had concerns, but was not robust enough to have mandatory testing on a regular basis across our community. But as the testing technology improves, I can see that we may have that in our future. And we have 3.5 months looking at the spring semester to make those plans and look at those things. And that's just a start of the answer for why we don't have mandatory testing.
Thank you, Dr. Weismantel. I know we're going to lose Dr. Vale at exactly 4:30, so I do have a question I want to pose to you before you have to jump off, because it has to do with the public health law and landlords. Is there any obligation of a landlord associated with a quarantined house? Are they notified? And how might the residents help facilitate whatever might be required of a landlord based on the law if necessary?
I don't believe there's anything in the public health code that requires
Oh.
the landlord to be notified. So, I mean, obviously the addresses are there, and so the landlords would know. But there's not a duty within the health code to make that notification.
Thank you. So we are at 4:28, I believe. And if I'm wrong about that, then we're at 4:29. But I want to give each of our panelists an opportunity for a closing comment or statement. So Dr. Vale, knowing you will have to jump off, we'll start with you, and then I'll go through everyone else on the panel as well. But I want to extend my appreciation to all of you for taking the time this afternoon. We may need to do it again. I still got plenty of pages of questions here, but I do appreciate your conscientious response and understanding what our students are concerned about at this point, because they just didn't feel like they had enough information along the way. And that's what the purpose of today is. So Dr. Vale?
So closing remarks, we need your help. These numbers are exceedingly high. They're the highest we've seen in this county. They're amongst the highest that have ever been seen in the state. They're higher than a lot of other universities, some of which have gone back to face-to-face learning. So we're concerned. We're deeply concerned about you. We're deeply concerned about the community that surrounds you. And we're deeply concerned about the impact that ultimately the exceptionally high transmission in this community will have 2-3 transmissions down the road to people who might be vulnerable. Those people that we know that are disproportionately impacted by COVID are people of color. They are people who have chronic underlying health conditions. They are the elderly. We have often basically, acknowledged that in general, younger people do not tend to get as sick. Typically, they didn't get sick as often. Right now, the highest case rate per age group we have in this county is 20 to 29. At least 40% of our cases right now in this county are in the 20 to 29 age group. So the fact that that age group doesn't get COVID is clearly false. We try to say, you can get sick, and you're right, you're likely not going to get seriously ill. I have children who have been through college and are out. I have grandchildren. And, if somebody tells me that, chances are you're not going to get really sick, but it's possible. It's possible to have a stroke. It's possible to die. It's possible to end up with long-term consequences like myocarditis. It's possible to have a multi-system organ dysfunction disease. I don't want to roll that dice for my children. So that hopefully is an impactful statement, but doesn't seem to have been an impactful statement. Beyond that, it's like, okay, we understand that you are not the ones that typically have the more severe consequences in the deaths. But what about your parents? What about your grandparents? What about your other people in the community, your house mothers, the other people that you interact with in the community that are older than you or are in one of those age groups who are more likely to have severe consequences from getting COVID? And for some reason, if you don't see that, that doesn't seem to be impactful either. So all I can say is this, beyond that, to try to get this impact across. And I don't know whether it will be impactful or not. I hope it is. But we saw a significant outbreak in this county in June, late June, early July. Very, very small compared to this at this point. And At that point in time, when that started, we had 29 deaths in this county. And for the next 6 weeks or so, really straight through the end of July, we didn't have any more deaths in this county. We've heard Dr. Caldoun refer to serious illnesses and death as a delayed indicator. Even as a scientist myself, my brain went, oh, people get sick, eventually they get sicker, eventually they die. It's like, no, it's that transmission from you to somebody, to somebody, to somebody. So what happened in this county after increased transmission that pales in comparison to what's going on right now is 10 people died in the month of August alone in this county. I receive those calls when they come in and get to listen to the stories from the hospitals about these deaths. They come all hours of the day and all hours of the night. And I'm seriously concerned, one, about you all, for sure, about your surrounding community, but as it now moves out, because the transmission level now in this area is so high, as it moves out, if I had 10 deaths as a delayed indicator from what we thought was a really large outbreak, but pales in comparison to what we're seeing now, I'm very concerned about what's going to happen with regard to people who may lose their lives in October and November if we can't get this under control.
Thank you, Dr. Vale, and we know you have to leave, so we do appreciate your being with us, and more to come, rest assured. So thank you. Dr. Shoyinka. Maybe she did not get reestablished in her connection. So I'm going to move on and ask Dr. Weissmantel.
Yeah, it's hard for me to follow up on what Linda Vale had to say, but what I will add is what she said is absolutely right. And the most important thing that we can all do is make sure that if we're not feeling well, to go get a test. If we think that we are in close contact, to get a test. And if that test is positive, just please answer the phone, talk with me or my staff, and then Linda Vale and her staff about what we can do to find others to help them get testing and keep themselves safe and help keep our community safe. So it's just taking those next steps so that we can help each other and help keep each other healthy. So I'll just stop right there because Linda did a superb job of summing up why this is important.
Thank you so much, Dr. Weissmantel. And I just have to give you a shout out while we're here. Dr. Weissmantel just continues to respond, to be responsive to the things that are important for us as a campus. In his role as university physician, he has been tireless in just staying at it and being unflappable in the process. So thank you, Dr. Weissmantel.
You're welcome.
Dr. Strong.
I'm a former member of fraternity from my undergraduate days. I helped out with the National House after I graduated. I'm an East Lansing resident. I have underlying health issues. I need you to be the leaders you claim to be. I need you to care about me and care about my friends and my colleagues and your professors and everybody else. We know it's not impacting you to the extent of as far as the illness goes. And I would hate to be quarantined. I know I would go stir crazy, but I'd do it for you. So please do it for us. Please take care, be safe, be smart. Thanks.
Thank you. Thank you, Dr. Strong. Okay, my personal appeal, my admonition is that as leaders, as Spartan leaders, as students at Michigan State University, I know you care. I know you are caring. And I ask you to show that you understand what is at stake at this point. I ask you to think about gathering. I ask you to think about what it means for you to decide, yeah, I just want to get together with X number of friends. Whatever X is, it could be a problem. So I ask you to think about that. You are in houses with others and you have that connection of people that you can relate to. You may need to quarantine in a room and use a particular bathroom, but find ways to stay connected on your devices, on FaceTime, and all of those other ways, but remain physically distanced, remain socially engaged. Think about everything you've heard today. Do the right things to make sure that the community understands just who you are as leaders, that they see you making a difference for this community at this point in time. You've heard all the words: uncertain, unprecedented. We just don't know what's going to happen. All of those things are true, but we know what we can do. We know that each of us can assume the personal responsibility to make a difference in this pandemic. This is an illness. It is a respiratory illness. There is no stigma associated with that, but we still have to act as though it is urgent. We have to act as though everyone has COVID-19. We don't want to get it. We don't want to share it. We don't want to be the person who transmitted it. So I ask you, step up, step into the space that and the place that I know is a part of who you are. I know you care. I want you to know we care about you. We will be coming back to you to offer ways that we address your emotional health in this context as well. So thank you for your time today. Thank you for caring. Thank you for being a part of this experience. Reach out to any of us and let us know what we can do to support you. I adore you. I'm a member of the community as well. And so let's make sure that people understand fraternity and sorority life makes a difference. Thank you all for being with us today. Have a good week.